Welcome to Western Wisconsin Journal. I'm Meg Heaton. I'm a retired reporter for the Hudson Star Observer. And over the course of the 30 years I was there, I had an opportunity to do lots of stories with the United Way of the St. Croix Valley, from John Coughlin to Ann Searles to all of the wonderful initiatives they've undertaken on behalf of the community, and really seen their profile grow over the years in terms of not just doing that annual campaign to fund other people, but taking the initiative themselves to really reach out and support people both directly and indirectly through resources and direct contact. My guest today is Jessica Neumann. She's the Community Impact Director for United Way St. Croix Valley, and she's going to tell us about one of the initiatives that is really important during this COVID pandemic. It's 211 St. Croix Valley. Welcome, Jessica.
Thank you, Meg. Thanks for having me here. I'm so happy to be here.
Well, good. And can you tell us about 211, just what it is? I love these three number things that I can do very quickly.
Isn't that great? It's so easy to remember. It rolls off the tongue. You don't have to remember all the phone numbers for all the resources. No. You can just remember 211. 211 is a 24-hour service. It's one of the approved 11 numbers through the FCC, like your Diggers Hotline, which is 811, 911 for emergency services. 211 is a national hotline that anyone can call, but it's managed on a local level. So we are part of the Wisconsin network of 211 call centers. We have a call center right in Hudson that serves 4 counties that our United Way covers, which is Pierce, St. Croix, Polk, and Burnett counties. Individuals can dial 211 24 hours a day, 7 days a week, and find information on things that they need help with, whether it's finding out about food pantries or rent supports, financial supports. You could find mental health supports. You could find where to take the dog that you found walking down the street because you're not sure where to take it in your community. Wow. We're here for all of those answers, especially, so we're here.
Okay, go ahead. I'm sorry, I didn't mean to.
No, go ahead.
It's not just something that's developed over the pandemic.
No, we're here.
Goes on all year, all 7 days a week, 24 hours a day. Wow.
Absolutely.
I don't think a lot of people realize that. Yeah.
Exactly. One of the things, 211 has been around for a long time, and our area used to be managed by the Greater Twin Cities United Way 211, which we were grateful for that service, but their capacity to be able to be integrated with our nonprofits and understand the needs of our communities was not reflected in what they were able to provide with 211. As you shared, our United Way has grown from just a granting organization to one of service, and one where we really work in partnership and concert with our nonprofits to fill gaps. Us bringing 211 to the St. Croix Valley came out of a similar partnership with Healthier Together, which is our community's health coalition. And one of the requests through our community health assessment was that we need a one-stop shop for all sorts of resources. Instead of each nonprofit keeping their own resource list and working to keep it up every year, we need one stop. One nonprofit told me it takes their intern, the first week every year for their intern, is to update the resource list. Now, if we multiply that by the hundreds of nonprofits that are working across our sector, that's like 4 years of work that could be done. So what we are able to do with 211 is curate a list. We work closely with our nonprofits to make sure that all the information is up to date, especially as we go into something like COVID. And then we're able to answer those calls. When someone calls for rent support, we'll also say, do you need food or utility supports? How do we really kind of build a support web around individuals? And then when it comes to times of need like COVID, not only are we here 24 hours a day, but we're here as a disaster response partner to our counties. We help not only share information out to our community of where to go, what the correct information is, and how they can connect, but also we collect that data for our counties, and we're able to report that back up. So in the terms of like a physical disaster, like a tornado or a blowdown, we're able to say this is how many people were impacted and this is the type of damage that they had that then can be reported out to FEMA. Oh, wow. Additionally, with systems like COVID right now, we did start our emergency response on on March 14th, system-wide throughout the state of Wisconsin, our call volume has been up 178%.
Wow.
And we are working in concert not only with the state Department of Health, but our local county departments of health to report back out to them the types of calls we're seeing, the needs that we're hearing, and then we're able to respond to those needs in concert with those organizations.
Who are the people that are actually answering the phone?
So in our call center, they are staffed with information and referral specialists. Some of them are staff. Some of them are volunteers who have gone through extensive training with myself and some of our other staff to know how to best serve. You don't have to be a professional to answer the phone. We have all the information from a database standpoint already curated. To answer the phone, you really need to be empathetic, to know how to listen, and then understand how to use the database to refer that information out.
Yeah. In terms of what kind of calls have you been receiving through this? Is it mostly COVID calls? You said it's up dramatically, it sounds like. What kind of calls are you getting?
Yeah, so it's interesting to see the change. They're kind of cyclical. It depends kind of on the news hour, because we get, we get questions as part of the news cycle, right? When there was news about masks, what does that mean for us? When there's news about food resources, what does that mean? But overall, I would say that our calls have been, they have been dramatic about symptoms and understanding how they can keep their families safe. And then in addition, they continue to be what our top needs are, which is rent, utility support, community shelters, and food. So the needs haven't changed. We just know that they've grown in those that need it.
And is there any, I'm assuming this is pretty much anonymous, or how do you track that? How does that work?
Yeah, so it depends on the situation. We do, it is an air of anonymity. I answer the phone sometimes, but you won't ever hear me say, "This is Jessica." We all work on an anonymous scale so that our friends and neighbors can feel comfortable. Everything is confidential. Nothing leaves the office. And so the stories that you hear shared about 211 are shared with permission of those individuals and done in a way that it is respectful of their privacy. We also, we can go further. Generally, we don't ask names and phone numbers unless we need to follow up with an individual or we need to advocate on their behalf. So we try to keep the anonymity there for individuals as much as they like. Everything is really client driven. If you call for one need, I can suggest 10 other things that you might need and point you in those resources. But if you're not ready for those, we're not going to drive down that path. It really is driven by the individual who is calling. The nice thing with that, though, is a lot of the situations we deal with are really stressful. I deal with a lot of people call and say, I'm struggling with my rent, I'm struggling with my utilities. And then as we get into the conversation, we can hear the mental distress. And so we're able to ask other questions like, do you have friends and family that are there to support you? If not, can we give you the number for a warm line for just somebody that can be a listening and supportive ear during this time? So we're able to really look at a bigger picture and support folks. From a COVID perspective, I would say that our calls are getting longer the longer this goes on, because people do need more of that mental health support. Calls that were just really looking for information a month ago now are hanging on for 15 to 25 minutes as opposed to the 5 to 11 minutes.
And is mental health one of the things that you can refer people for services or help with?
Absolutely. We can refer for services, and we don't just refer by giving a phone number and an address. We let them know what the service is, what they need to bring with them, how they might pay for the service. So if I'm referring to mental health, we will ask about their ability to pay. And if they're not able to pay, then let's get them hooked up with either a free or low cost service, or get them introduced to an organization that helps them get connected with payment options like insurance. So we really want to look at the whole picture and make sure that people understand what they need when they're going to an organization. For instance, if you go to a food pantry, oftentimes they'll ask that you bring a driver's license and then proof of your address. Most people may not know that about your food pantry, but we prepare folks that these are the documents you're going to need when you go there, so that when you get to that next step, there isn't another barrier, that they're opening the door and saying, yes, you have the right documents, and we're able to help.
Well, that makes a lot of sense. And you know, you don't think about that, but how often we get frustrated when that happens, just, you know, calling for information on a regular basis. But if you're after food or mental health help or medical help, you know, that's the last thing you want to run into. You said can people connect 211? One of the things that people like my age and older, can you use a regular phone or do you have to have one of those smartphones?
You know, the great thing is, Meg, that 211 is ready to meet people where they're at. So
Mm-hmm.
yes, please, if you have a landline or a 715 area code phone number, dial 211. If you have an area code other than 211, we have an 877 number. That number is 877-947-2211. We also have a website for those that are really research junkies and want to go and look for it on their own. They can go to 211wisconsin.org and find all of our resources listed. Additionally, they can text us for the generation that doesn't want to talk on the phone. They can shoot a text they text their zip code to 898-211. And they're able to receive those resources as well. So we really are there to meet people where they're at. It doesn't matter if you speak English or not. We have translators. I've spoken with folks that are hard of hearing that also have other phone supports. So we are here to connect with people in any way, shape, or form that works for them.
Wow, that's incredible. I can't imagine. I didn't know anything about this before this all happened. So another sort of silver lining of COVID, I guess. But the other thing that you mentioned too is that because of the comprehensive way you approach information, you're also available to answer questions that right now might be burdening public health or the hospitals or people who really don't have the time to maybe sort through these things or give the amount of time to listen to somebody. Can you talk a little bit about that?
That's exactly right. So when we think about all the questions that folks have about COVID, a lot of our questions were around, what are the symptoms? I just am curious what those are. If those calls are going to our public health department, then they're not able to stay on top of the other things that they need to manage. So we work in partnership with our local health departments as well as the state, and we have that information readily available. It's updated as often as it can be. It can be updated in the middle of the day sometimes or overnight. But as new symptoms emerged, we saw that new data coming through our network that we can share out with individuals. So we really are here to lift a burden off of those that are working so hard to protect us. When is the right time to call your doctor? If you're not showing signs or symptoms, will you get tested? These are all questions that folks may think to call their health professionals for, but at 211, we're here to support and maybe lift off some of those general question burdens, not only during COVID, but any other time of the year and any other disaster.
Yeah. We could have another disaster, who knows? But one of the things, obviously, so many of the services that United Way provides come through the annual campaigns that we mount, and that money, a lot of it stays locally. Can you talk a little bit about how people can maybe reach out at this time particularly, or how they can support United Way's efforts?
Absolutely. So Meg, what I'd like to say first of all is we are a local organization. We have a local board of directors. You talked about John Coughlin's legacy, and he made sure that we really had a great, strong foundation in our communities. And with that, our dollars do stay local. The only dollars that go out of our local area are to support our administrative needs through United Way. It's a very, very small percentage. So those individuals that want to help support us, you can donate at unitedwaystcroix.org. Or you can give our office a call. Best way is to go online or through Facebook, and you can donate that way. You can leave a message at our phone, and we'll get back to you as soon as we can. We are working from home, as you can see, like lots of us during COVID. So we're able to do that. We do have some frontline work that is also happening. So if you're looking for volunteer opportunities, you can go to volunteerwisconsin.org and type in your county that you're looking for projects in, and then they'll show you what's available not only for United Way, but for all of our nonprofits in the area. We currently distribute food to 25 food pantries and shelters in our counties that we serve. And so that food work is not only continuing to happen, but also expanding, as we know there's an expanded need for our pantries and pop-up pantries. So we're here in those capacities as well.
And I know that you are Miss 211, but I know you mentioned the food pantries, the other initiatives that are happening with United Way right now.
Yeah, so really one of our main focuses is for food. We work on the health, education, and financial stability of our county. Every day we're fighting for that. So from a financial stability perspective, we work on food security. And that, like I said, we give a monthly distribution of fresh fruits and vegetables, proteins, and other healthy foods to our food pantries, because those can often be the most expensive for them to procure. And we're able to order those through a wholesale, and we buy in bulk. So we're able to get a really great deal. In fact, when you think about donating for food, lots of us think about donating items, but our work, we're able to take your $1 that's donated and purchase $8 worth of food with it. So it really, the donations have such a, an 800% more impact when you're able to donate dollars to us, which is important. Additionally, we've been able to distribute emergency bags of food for frontline workers as they encounter individuals who haven't been able to get out, who need food urgently. We did have an individual call 211 one evening early in COVID and said, I can't leave my house because I'm elderly and I have no food. The cupboards are bare. And so we were able to work through our systems and volunteers to get food delivered to that individual within 3 hours. So we're grateful for that ability to react and really help folks in need. Additionally, we are working with our counties and other organizations to look at who are the vulnerable populations and get food and supports to them as well. You'll see on our Facebook page, we've been working with our child protective families and making sure they have activities for their kids, making sure that they have interactive pieces. We're not all built with the skills to parent, and so if we can help those folks, especially during this incredibly stressful time, to have some tools to make it easier for everyone in the household. We're there to support that as well through our Success by Six effort. And then we continue to share mental health supports. We work with with Healthier Together on mental health first aid. And we have trained over 1,000 people prior to COVID in mental health first aid, which really gives you the tools to understand how to support an individual who may be experiencing either early signs and symptoms of mental health or in a crisis situation.
Mm-hmm. Mm-hmm. And I remember before I left the paper doing, you were very involved in the family friendly businesses training, and
Right.
Obviously businesses have to be very family friendly during all of this. And so I know that some of that training, even beforehand, has got to be coming in helpful now.
Right, absolutely. I muted myself, sorry. We're really here to fill gaps. We're not here to create programs where somebody else is doing that. Our job in those cases is to lift up the nonprofits that are doing that incredible work. And then when we work with them to identify the gaps, they come to us and say, this is where a stopgap is for us. And then we work to bring other partners together to solve that problem.
Mm-hmm. Yeah, that's what I think is so amazing about our United Way, that it's really a collaborative effort on behalf of the entire community, and this is just an amazing resource to people, and one where you just dial one number and you can get all the answers you need. That's pretty good. And you don't get
That's
put
right.
on hold with music going on in your ear.
Yeah, that's right. And oftentimes before 211, we were able, individuals were having personal emergencies and they may have dialed 911 when it wasn't the right resource. So we're able to also lift off that system and make sure that that system is really getting to the needs that they have. We are connected with them in the off chance that we end up with an emergency on our hands. We're able to connect and get to those crisis resources as well.
That's great. That's great. Is there anything else I haven't asked you about that you want to mention?
Oh man, we covered a lot of ground, Meg.
Yes, we did.
I would say that the biggest thing to note is that we're here 24 hours a day, 7 days a week, not just for those in need, but if you have a friend, family member, if you're at work, feel free to call us and just say, hey, this is the problem I'm seeing. What are the resources? And we can share that information with you. You can always search our website or use text, but when you call, you definitely get a friendly voice on the other end who can listen and help brainstorm about solutions to challenges.
That's great. Jessica, would you give us that 800 number again for people outside the 715 area code, and the texting number?
Absolutely. So for those inside 715, it's just 211. Mm-hmm. Those outside of 715, so if you have a cell phone that's outside of that, it's 877-947-2211. Okay. And then to text, you'll text your zip code to 898 211.
Great. And the website?
211wisconsin.org. And our local United Way website is unitedwaystcroix.org.
Great. Well, thank you very much, Jessica. This has been very informative, and it's just very reassuring to know that 211 is out there.
Oh, well, thanks. We're so appreciative of all the work that we get to do, and it all happens because of great partnerships like we have with you and our donors across the county. Counties, we're really in a wonderful community, and we're grateful to be a part of it.
Yes, we want people to give big because it matters.
That's
so
right.
Thank you so much, Jessica. Appreciate it. Stay safe.
You too. Bye-bye.